What is knee replacement surgery? Knee replacement surgery is actually not replacing the knee joint. What we need to do is we need to explain this on a model. So this is a model of a knee, and this is the plastic femoral bone, which is a thigh bone. That's the plastic tibial bone, which is a leg bone. And between the two bones there is a cushion, we call it cartilage, which separates the two bones. This cushion helps the body to move the joint very easily, and when the cushion is good and normal, there is no friction between the two bones. The bones are moving very easily. In arthritic knee, this cushion, the cartilage wears out, because of which now the bones, instead of having a gap between them, start touching each other. And then they start, then they start giving crepitus, and they start giving crackling sound. So what we do in knee replacement is actually, this is a bone which is covered by the muscles in the front. We make a small cut in front of the knee, split the muscles, and we can see the bones between the muscles. Now we use a special instrument to clean the top bone, and we put this knee cap. This is a real like model, and this actual piece is sitting on your bone like this. Once we put this bone on the top, this cap on the top bone, it becomes smooth. We push this bone behind, then we use a special other instrument, clean this bone completely, and put the second cap like this. This is also a real cap which fits on your bone like this. So this bone becomes smooth, and then we put this plastic disc which function like a cartilage between these two caps, and connect these two caps together, make the knee straight, and then close the muscles from the front. If you notice that now when you bend the knee and extend the knee, this bending and extension or movement of the leg happens between these two caps. The friction between the two bones have completely stopped. If you notice, we have not done anything to the actual structure of a knee joint. The bones are the same old bones, the ligaments are the same old ligaments, the muscles in the front are the same muscles which we just split and sutured together. The kneecap is also in the same position, the capsule cover is also same. What we have changed is the surface of the knee, which is new now. So the friction between the bone has completely gone. The bend in the knee is corrected. So now the knee is stable, it can take the load, it can bend, it can extend. So this operation, which is normally called knee replacement surgery, is in reality a knee resurfacing operation. We actually have just resurfaced the knee joint and not replaced the whole knee as many people believe. And this will eliminate the pain, this will make the knee appear straight, it will make the knee stable, and the patient will be very comfortable after the operation.